Now I'll take you all the way to the present. In New York, we had a huge vegetable processing industry. And it's still fairly big. But in the past 20 years, yields have started dropping. And they've dropped fairly strongly. They've not only dropped, but the chemicals that were solving our insect problems weren't working anymore. The fertilizer, it kept taking more and more to maintain the same yields. And people observed, and this really played into how people relate to each other, that what we called the good land. The good land was where you could grow vegetables and get high yields and make money at it. Well, the amount of good land seemed to be shrinking. There would be farms that were considered good land and people fought over them 30 years ago that now are considered junk. The stuff doesn't grow anymore. And we came up with a term. I use that term loosely. There was a group of professors at Cornell who involved farmers, including myself. They called it soil health. Isn't that an interesting parallel? Soil health. You know, we deal with human health in terms of disease. Now we're dealing with soil health in terms of disease, sickness, problems. And what the professors, and this is very much in keeping with what Goethe's original criticism was they brought together all the disciplines. They had soil physicists, they had soil chemists, soil biologists, people who studied fungi. They tried to bring all of the university disciplines together. It was a radical idea. University research is done on single factor analysis, looking at one thing at a time. But when we ran out of ideas, and when we ran out of things that worked, in desperation, we started trying to pull everybody together and look at this in a more holistic way. And what the soil health, and they call it a program work team, found was that declining yields were the result of declining soil health.